I'm Dr. Paul Shotbolt, and I'm the Programme Lead for the Clinical Neuropsychiatry MSc, which we're in our first year at the moment, so next year's intake will be our second year. So I'm just going to tell you a little bit about the course. So first of all, what is neuropsychiatry? It's a question I'm often asked, and it's kind of at the interface between neurology and psychiatry. And that we have sort of two main areas that we work in. Firstly, the physical, I suppose, organic or neurological causes of psychiatric symptoms, and these are things like the dementias, so Alzheimer's, Parkinson's, Huntington's disease, etc., vascular dementia, that kind of thing, and also epilepsy and brain injury. And the other bit, so that's one big group of patients we see. The other big group are the sort of psychiatric mimics of neurological disorder, what used to be called hysteria or conversion disorder, and what is now called, the popular word is functional neurological disorder. So these are patients who present with neurological symptoms with no known physiological or neurological cause. So an example would be a patient who presents in a wheelchair and has their whole neuroaxis scanned, so their spinal cord, brain, etc., can't find anything wrong, but they still have got weak legs. So that's the other kind of patient group we work with. And I think neuropsychiatry is interesting because the first group is very organic and biological, and the second group you're working on a much more psychological level. Clinically, neuropsychiatry is a subspecialty of general adult psychiatry. It's of growing clinical importance, partly because people are realising the burden of neuropsychiatric disease is very high. For example, I've seen a statistic that shows that the cost of functional neurological disorder for the country is greater than that of dementia. And the main reason for this is that primarily these patients are working age adults, so there's an effect on GDP, and they use a lot of resources, and they can be chronically disabled. They use a lot of health resource, and also they're out of the employment world. So because of this growth, the plan is for all regional centres to have a neuropsychiatrist, and more particularly a neuropsychiatry service. And so a neuropsychiatry service involves lots of different professional groups, such as neuropsychologists, occupational therapists, physiotherapists, CBT therapists, etc. So it's not just about neuropsychiatry. At KHP, we are the biggest neuropsychiatry department in England, probably in Europe. We've got one professor of neuropsychiatry, and we've got 4 professors of neurology. The seminal textbook, Lishman's Organic Psychiatry, was written in our department, and we're also the home of the journal Cognitive Neuropsychiatry, and we do loads of research into various different things. This is just an example here. So conversion disorder, as I said, functional disorders, we've got 4 trials ongoing at the moment. Chronic fatigue syndrome is a big thing in our centre. And we've also got a Centre of Excellence in Neurodegeneration, the Wole Neurosciences Centre, and we're also a Parkinson's Disease Centre of Excellence. And I'll talk quickly through our clinical strengths. We've got 7 clinical neuropsychiatrists, and all of us work very closely with neuropsychologists. We're one of the biggest regional neurosciences centres in the UK, and we provide neuropsychiatry service for the whole of the South East. We've got an inpatient ward, we've got outpatient services, we've got a day hospital, we've got a brain injury unit, and we're also heavily involved on the neurology side with things like the Epilepsy Surgery Centre, deep brain stimulation service for movement disorders, and we also, on our side, we provide a CBT service, cognitive behavioural therapy service, for patients with functional neurological disorders. Setting up this MSc is really to take advantage of our enormous resources, and we've got a lot of huge cross-disciplinary or access to cross-disciplinary teaching potential. So we have teachers on our course from psychiatry, neurology, neurosurgery, neurophysiology, psychology, and all of the people that lecture on our course are leaders in their fields. So the aim of the course primarily is to train the next generation of neuropsychiatry clinicians, and also the next generation of neuropsychiatry academics. And what we really want to do for the students on our course is we've got 4 main learning objectives. So teach people knowledge and understanding of the main neuropsychiatric disorders, give people critical appraisal skills, give people practical skills, both in assessing and diagnosing patients, and also in project management and scientific writing. And we also want to instill generic and transferable skills that could stand you in good stead whatever direction your career takes, such as literature searches, problem solving, and inquiry-based learning. So the course structure, there's full-time and part-time options. Full-time is 2 days a week for a year, part-time is 1 day a week for a year. There's 4 taught modules, and there's a research project, and there's an optional 1-month clinical placement or clinical observership. And there's a huge variety of places you can do that, from an inpatient brain injury unit to outpatient psychology services such as psychotherapy services. You could do neurophysiology, you could be attached to a neurosurgeon, so really a wide range of clinical placements you could do. There's the 4 taught modules are, firstly, the scientific underpinnings of neuropsychiatry. The second is about the disorders themselves. The third is about managing, so treating the disorders. And there's also a 4th, research methods and stats module. This is just an overview of what's in the different modules. I don't expect you to read all these, but the first module is very much sort of basic science based, so things like neuroanatomy, neurochemistry, etc. The second module is the disorders themselves, and also things about diagnosing the disorders. So there's a lecture in there on EEG, electroencephalogram interpretation, and also interpretation of brain imaging from MRI to PET scanning, and also other things like cerebrospinal fluid biomarkers, bedside cognitive tests, etc. And then you go on to term 2, and there's more about the disorders themselves and the different types of disorders you see. Module 3 is all about different types of treatment, so psychological treatments, psychiatric treatments, medication, etc., neurosurgical treatments, neurorehabilitation. So we focus a bit on the different treatment modalities, and then we go on to specific treatments of different disorders themselves. Module 4 is the research methods and statistics module, which is shared with another MSc, affective disorders, and it assumes no prior knowledge of stats. So people always get a bit worried about it, unsurprisingly, but it's really quite, it starts very slowly and gradually, and you don't need to worry about going into it with very little knowledge of stats at all. And I will say with the other lecture modules, it's not just lectures. We do try and have more interactive sessions, so seminars and practical sessions. So it's not just being talked at for the whole of the taught course. We do try and encourage interaction and do practical things like try an EEG machine, this sort of thing. So why choose our program? So we're set up to train next generation of clinicians and academics in neuropsychiatry. There's a shortage of training opportunities in the UK for neuropsychiatrists, so we're trying to fill that gap. We've got access to a really wide range of academic and clinical departments across King's Health Partners. So that includes King's, the Maudsley and Guy's and St Thomas's hospitals. And also we've got a very dedicated MSc team who have a real depth of teaching and clinical experience. Thank you.